over. So we're going to go on to introductions. So my name is Matt Howard Murray. I'm the Public Involvement Lead at Cancer Research UK, and my work focuses on data and artificial intelligence. And I'm really interested in this topic as it's something that the learnings I really want to bring into my organisation's work. We are proud to be a partner with PEDRI, and we're really pleased to be part of this joint initiative to get really good practice, public involvement and engagement in data research. I'm going to be chairing today and hoping to bring to life some of your questions that you put in these for the second half of the session. But actually the main bit, the bit you're most interested in, I'm sure, is hearing from our speakers from the Centre for Ethnic Health Research. So I'm going to introduce all three of our speakers now, and then I'm going to hand over to them. So first off, we have Sunny Rohit. For nearly 25 years, Sunny has dedicated his career to youth, community and sports engagement, development and management. He's passionate about empowering individuals and communities to improve their own health and well-being. His approach focuses on creating accessible opportunities and fostering environments where everyone can thrive together. We are also joined by Krishna Patel. Krishna is a Community Engagement Officer at the Centre for Ethnic Health Research, University of Leicester. She's a strong advocate for improving the inclusion and representation of ethnic minority communities in research. With extensive experience facilitating workshops, focus groups and wellbeing sessions, her recent work has focused on women's health. And then we've got Gurpreet Gruel Santini. Gurpreet is a Community Engagement Officer with experience in communications, broadcasting and community development. She supports research through PPI work, focus groups and community talks. She's passionate about using textiles and the arts to engage communities, and she's committed to involving people from diverse backgrounds, including those who are deaf or for whom English is not a first language. Gurpreet works to empower people with the knowledge and confidence to take an active role in research. So without further ado, I'm going to hand over to Sunny and the team. Thank you.
Thank you for the great introduction, Matt, and thank you for inviting us to present today. We are very excited to be here this afternoon. As Matt mentioned, my name's Krishna Patel, and I'm a Community Engagement Officer at the Centre for Ethnic Health Research. Next slide, Sunny. I'm joined today by my colleagues, Sunny and Gurpreet, who are also Community Engagement Officers, and you'll be hearing from them a little later in the session. Next slide. So today we'll start with a quick overview of the Centre for Ethnic Health Research. Then Sunny will share the key principles and steps for effective community engagement, followed by Gurpreet, who will be talking about working with minority ethnic communities in data research. And to finish, we'll open it up to you for any questions or discussion. So the Centre for Ethnic Health Research has one clear vision: to reduce health inequalities. Our main purpose is to inspire and develop collaborative partnerships to inform strategy, research and services aiming to reduce ethnic health inequalities. We are funded through the NIHR and the University of Leicester. We lead on the NIHR ARC East Midlands cross-cutting theme of ethnicity and health inequalities. We're located in Leicester, one of the most diverse cities in the UK, and are based at the Leicester Diabetes Centre, which is a unique and innovative partnership between the NHS and academia, and we are situated on NHS grounds. Always good if you need a band-aid. We have set ourselves 5 clear objectives for us to work towards our aim and purpose, which is written in teeny tiny words on the screen. Thank God the slides will be shared at the end. The primary objective of the Centre is to reduce health inequalities for ethnic minority and migrant communities by involving and understanding their needs in healthcare and research. This involves building community capacity, promoting co-produced research and services, increasing diversity in research participation capacity, developing culturally sensitive resources, and shaping national policy to address systematic barriers in healthcare access and outcomes. We have a passionate, dedicated team who successfully deliver our objectives. Next slide. So in the first box, we have community involvement. We often bring people together at events or workshops we run to learn, share, and take part in activities that improve health and well-being. It means working with our communities, listening to their experiences, understanding their needs, and empowering them to make positive changes for themselves and others. It's really important to us that we give back to the communities we work with. That might mean being at local health events, sharing knowledge, or raising awareness of different conditions. Sometimes it's about providing training, like how to screen for type 2 diabetes risk, or delivering a health promotion program that's designed specifically for that community. We always try to give back to build relationships and trust. When communities see that we're genuinely interested in them, they're much more likely to support us with research because there's that mutual respect and understanding. One example is the Devi project, which I'm currently working on at the moment. It's all about engaging South Asian women in physical activity through salsa dancing, while also creating space for conversations around mental well-being. The second box is we also run training sessions, and I'll tell you a bit more about those training sessions in the next few slides. We have developed research and resources which can be found on the centre's website, from resources about participants looking for after their physical and mental health to improving digital health management of South Asian people and type 2 diabetes using digital health. It's all there. As mentioned before, the centre's overall aim is to reduce health inequalities. Much of our work to do this is through qualitative research, which is representative of these communities, or it may be research investigating and understanding certain barriers to help us improve access or health service provision. We also implement programs directly into the community to try and help them improve ethnic health inequalities. Whatever work we are doing, community engagement and involvement is hugely important. The Centre has also established itself as a leading light in the area of EDI in research. As part of our leadership role for equality, diversity and inclusion of underrepresented groups in research, the Centre, alongside the EDR committee, set up an EDI webinar series to share knowledge and experience on elements of EDI to ARCs and wider research networks. You can download all of the toolkits on the Centre website. We hold monthly interactive workshops designed to provide valuable support for individuals in carrying out an equality impact assessment, which is a process designed to improve equality analysis, practice and outcomes. Again, the details can be found on the Centre and the NIHR websites, along with a toolkit which has now been developed, consisting of comprehensive training and a directory of useful resources. Next slide, please. The Centre team brings a broad range of expertise, enabling it to deliver a variety of challenges and activities. These include academic and community research, public involvement, strategic development, policy commissions, and evidence reviews and resources development and training to address underrepresentation in research. The Centre's awareness and reputation continue to expand, with service requests for collaborative support and engagement with underserved groups increasing year on year. These requests have come from a range of stakeholders and locations to include industry partners, academics, NHS trusts, and the charitable sector. Between 2021 and the present, a total of 727 external support requests have been received. We have expertise in qualitative and quantitative methodologies. With a team of research academics and community engagement officers, we can offer input at all stages of the research process. If you would like support, please complete and submit the research support request, which can be found, yes, you guessed it, on our website. Next slide, please, Tony. So all of this engagement increases our skills and knowledge, and it allows us to provide training and resources to others to help them effectively engage with different communities. The Centre has developed 2 training courses which are now delivered by 2 community engagement officers online and in person for academics and healthcare professionals to access. These courses are effective community engagement, which aims to increase knowledge and confidence to engage with ethnic communities and provide some practical guidance and considerations. Our other course is cultural competence, and this is aimed at increasing individuals' knowledge, skills and competence to become more culturally competent. Cultural competence is an ongoing journey, but the training certainly provides insight to how you go about that journey. We have also developed an online toolkit called Increasing Participation of Ethnic Minority Groups in Health and Social Care to ensure health and social care research is as inclusive and diverse as possible. Now, over to Sunny, who will share the key principles and steps for effective community engagement.
Thank you, Krish. Interesting as always. So we're going to run through some of the principles of community engagement. There is a lot of information to go through here, and we're trying to try and sandwich it all in the next 10 minutes. So if you want to elaborate on any of this, please obviously use the question and answer session towards the end, and obviously we can expand on any of this that we're going through now. So in terms of the principles of community engagement, obviously it's really important to undertake such to build and develop trusted relationships, to obviously meet the needs of communities, to target resources that we have effectively, to try and involve greater numbers of people, for us to support community empowerment and ownership. And it would allow us to then have meaningful and accessible communication with those that we want to serve. It will make research and services more relevant, and it ensures inclusivity of activities. And finally, one of the main important things of to be culturally sensitive, to respect traditions, languages, and values. In terms of engagement, we kind of categorize it into 3 stages. So we've got a pre-engagement stage, we've got a during engagement stage, and a post-engagement stage. What we've done is we've broken it down for you. We're kind of the key principles of each stage and what you need to look out for. So in terms of how to engage effectively in terms of the pre-engagement stage, we find it's really, really important to do your homework and to be realistic about what you want to achieve. Consider some pre-engagement activity, meeting informally, get yourself into the community, visit events and so forth, and what you need to do just to get your face seen in the community. We find that really important. It's really important beforehand to appreciate and understand things such as stigma, discrimination, and fear. Use the right people in your engagement and treat them as experts. Most communities will have almost like community leaders, or some people refer to them as gatekeepers. Try to build relationships with these, and they'll really help you going forward, potentially as co-facilitators. As we all do, we also learn from people around us, so it's important for us to learn from communities. Different communities may need specific approaches, but we're going to touch on that a little bit later. Think carefully about your strategy and process, so be clear on what you want to achieve. This one's a bit of a difficult one at times, because when you're unsure of something, you're not sure whether you can just ask. But with communities, what we found is that they want to share information with you. So don't be afraid to ask if you're not sure of anything, whatever it might be within communities. And as we're engaging with communities, we know that things aren't rarely 9 to 5. Unfortunately, we're obviously sometimes stuck in an office from 9 to 5. Much of the best work is actually normally done outside of these hours at times. So you've just got to be a bit more flexible and know that in terms of engaging effectively with communities, it might need to be done outside of these hours. And hand in hand do that, obviously you need to think outside the box. Really important to not be too formal about things at times. So if you're engaging with communities, if you're meeting with young people or elders, maybe just consider what you might need to do beforehand. For example, maybe just to dress down might be one of the examples that you could do if you're going to community members, or if you're going to a young person's group, just to try and blend in as much as possible. So just to obviously consider that beforehand. During engagement, like I mentioned in the previous slide, to involve trusted advocates, community leaders. Obviously, they'll help you try and develop your relationships in the community. Keep things simple and establish ground rules or agreements, like we like to call them at times. So build in time for people who may want to offload, and potential activities to encourage people to talk and also to take part. One really key thing is to make sure that all the language we use is inclusive, and even the images as well. So for example, as part of our community engagement training, we talk about jargon busting, for example, and it's really important when we go to communities that we maybe get rid of the acronyms. I know it's second nature to us at times, but we've been to community meetings when we've spoken about minutes, and people will look at their wrists and look at the time. So for us, it's obviously second nature, but it's really important to remember such things, that we need to use inclusive language and also images. Communicate appropriately, clearly, and regularly. Obviously, listening is obviously really important at everyday activities, even more so with communities. So active listening is really important. Be aware of things such as non-verbal communication. So hand gestures are very important in some communities. So, or you might think people are being overly aggressive with their hand gestures, but it might just be part of almost what they do in their culture. So obviously investigating into that beforehand is really important. You may need to consider providing translators, but on the flip side, you might not need translators. So don't presume just because you're going into a community who English might not be their first language that you need translators. We find that a lot of the time, communities are very confident in communicating with us in English, both written and verbally as well. We need to normalize things such as clinical practice and research. People can often be wary of authority and mistrustful of organizations. And there's obviously a barrier to effective community engagement at times. So we just need to make sure and be aware that there might be some mistrust already and some barriers that we might need to break down at times. This I kind of touched on the last slide. So think about what you wear and what your approach should be, just to make sure you almost blend into communities. Consider room layout. So this one's quite important for us as well. So we often arrange rooms into circles rather than having almost like tiered seats, for example, and podiums, because what we find in circles is there isn't often direct eye contact, and sometimes community members might not want to have direct eye contact and make things a bit more informal. So we find the use of groups in sitting in circles, we find that quite beneficial. And obviously, finally, give an incentive for people to be involved. We normally supply and provide vouchers just to say a little thank you to those who have been involved with the work that we do. The post-engagement stage, because for me, I say this in the training that we do, is I find this probably the most important out of the three for me personally. And I'll go into a few details why I believe that. So don't promise what you can't deliver. Remember to manage expectations. It's very easy to say, I'll make sure I get this done and this done beforehand, but we need to make sure that we're actually delivering what we promise. So obviously manage your expectations in that way. Do what you say you're going to do, because communities will not forget. So do make sure that you're saying the right thing at the right time to the right people. And again, feedback at the right time, using the right language and methods. We often find that communities feel as though we approach them, we do some work with them, and then we don't kind of feed back to them. And that's really, really important, because again, it's only of benefit to us to feed back to them, because we want obviously to keep engaged with them in the future as well. Keep records of what you do, listen to feedback and obviously act upon it, monitor and evaluate regularly and thoroughly, try and be reflective and change things when necessary. So that's about obviously the flexibility that we spoke about. Make sure you focus on maintaining relationships. Really important that going forward, if you've maintained these relationships, they're obviously going to be beneficial for both parties. And again, leaving a positive legacy, really important. I've got two visuals here. I'll describe what they were. So the first one was actually an event that my colleague Krishna organized. And what we had an illustrator come to an event on the day. And the illustrator spoke to many of the participants, got their feedback. And what he did was he put together like an illustrative thought board. And what we were able to do was go back to the community and share it with the participants, just to give them a reflection and a kind of a picture board of what was said on the day by all participants. So again, post engagement can be different. It can be creative. So just to bear that in mind, that there's obviously lots of different methodologies in terms of feeding back to communities. And at the bottom there, something very close to my heart is we've got a group of walking cricketers. So back in 2018, I started a walking cricket group here at the centre to try and encourage physical activity. What we found was we went out into the community, and a lot of the female population were really engaged with Zumba classes and yoga classes, but the men used to sit in the corners playing cards, and they just weren't interested in taking part in anything. So what we did was we did a obviously extensive consultation, and we found that they had a passion for cricket. So we started a walking cricket session 7 years ago. We managed it for about 4 to 5 years, and then what we did was we handed over the management to the Leicestershire County Cricket Club, the professional sports club. So they now manage it. They've been managing it for the last 2 or 3 years. But what I do, and this relates to the post engagement, is I make sure I go there at least once a month, just to make sure they remember who I am for starters, and just to keep them engaged. And that really benefits us because every time we need participants for research or focus groups, for example, they're normally my first port of call. And without hesitation, because we've had that relationship, they're really, really quick to volunteer. So, general things to remember. Find where communities are, where they congregate, where they meet, and where they feel comfortable. For us, it's really important. And a principle, again, of community engagement is for us to go out to communities. We shouldn't expect them to come to us. Cultural competence in approach and in practicalities, things like refreshments and language is really important. Consider people who are not part of organizations and groups. You'll find at times that you often get the same people coming to the same group. So try and obviously target others to try and engage as well. Showing your face is important. So there are many times where we're out in the community for no other reason than just for networking and showing our face. And that links in with the next point, which is consistency, and it breeds trust. So the more often people see you in the community, the more likely they are to kind of engage and to trust you. Remember that meeting people is an essential part of this work, and really, really importantly, to be grateful and to obviously say thank you to people. Common pitfalls, treating everyone the same. So we often say, oh, it's really important to treat everyone the same. With community engagement, it's often the case that we don't treat everyone the same. And this is partly down to cultural competency. So finding out what works with certain communities and making sure you adapt your style to obviously communities that you're working with. Inadequate preparation. So we spoke about the pre-engagement and to make sure that we're kind of prepared. Being unaware of past barriers to engagement, obviously not allowing enough time. We spoke about the importance of inclusive language. So obviously another common pitfall is using exclusive language that communities might not understand. Again, being too formal. I think it's really important as an engagement worker or doing any engagement in the community that you need to try and blend in as much as you can. I often say within training as well, take off your work hat, take off your lanyard, do what you need to do just to try and blend in with communities. Obviously, being patronizing can be a common pitfall. Insufficient feedback. So we spoke about post-engagement and the need to feed back to communities. Seeing things as a one-off exercise. Obviously, we're trying to build sustainable legacies like we spoke about. Not seizing opportunities. And finally, not being culturally competent. What are the consequences of getting things wrong? Lack of trust and confidence within communities. People feeling that they're being preached to. You'll always get lots of courtesy with communities. So they might say, they nod their head and say yes, but you'll see little progress or actual involvement. That's probably because you maybe haven't engaged as well as you probably like to with them. Disappointment, frustration, maybe even anger. Missed opportunities. People will say yes, but will they actually come back for future requests? It often creates a division rather than cohesion if you get things wrong. And obviously, really importantly, create stereotypes and or conscious bias. Finally, for me, an important part to remember is that what we're looking to do is to create a relationship where people feed back on what works as well as what doesn't work, where people give praise as well as offer criticism, where instruction prevails, where people work and live effectively together. So I'm going to now hand you over to my colleague, PEDRI, who's going to talk to you about working with minority ethnic communities in data research. Thank you.
Thank you, Sunny, and thank you, Krish, as well. Krishna described what we do at the centre, and Sunny pretty much said how we do it, and I'm going to just give some examples of my involvement in data research. Next slide, Sunny. So you can move on to the next one, please. So I've been working with our biostats team as a community engagement officer. Initially, I was a little bit nervous to get started with the biostats team where they look at statistical methodology. And I actually hadn't even heard of that kind of research, and I had no idea. And I felt, would I be able to actually grasp everything and then take it to the communities and explain it to them? So I had lots of conversations with my managers, and I thought this is a good challenge. I should try it. And 18 months later, I feel a lot more comfortable with the statistical methodology. We have a team where we meet twice a month. We call it PPI Smart Team, and any opportunity that we see for public involvement, we discuss it there, and we try and see where opportunities are to talk to members of the community and our colleagues. And with this PPI Smart, we've produced a glossary of terminology. Initially, it was, it's taken quite a few drafts because first, it was okay for people who already know terminology in research. But then when we take it to members of the community, they don't understand a lot of the terms. So we brought it down, a level down. And with that, we've had focus groups, one who is already experienced focus, members of the community, and the other one where people have not taken part in any research. And the findings were quite different and a lot of learning for us. For example, there are images that we were using for animations, for example, sunshine or flowers and things to explain the terminology. And we noticed men and women, their differences, how they see things. So, we've had many discussions, and to make it viable and interesting for everyone has been, quite challenging at times, because not everybody agrees on the same sort of an outcome. And I've supported many studies where we've needed to go into the community, look for participants from different and diverse communities, for example, cancer and ethnicity, missing data, and so on. Next slide, please, Annie. So this is our web page, which is used by our PPI Smart team. And you can see the glossary. Obviously, we don't have the animations as yet here, but this is just an example to show you where this glossary is shared with everybody who wants to know a little bit more about how this work is done. And we also produced a video which also explains statistical methodology. So when we run any focus groups, we try and share that video with the participants so that they are aware what it means for people to take part in research. So initially, when we reach out to members of the community, they may say things like, what is it, and how do I get involved, or what kind of a difference is it going to make if I get involved? So we sort of try and explain to them what it means by them bringing their lived experience to the table, talk to the researchers, and how they go away and make changes in our treatments and so on. Next slide, please, Sunny. So in our PPI Smart meetings, we've had like several discussions, and some of the discussions are, how do we understand more about the communities? In the recent years, the communities have been changing so much with the new migrants arriving and population changes and so on. So we have to be always working hard to look for new settlers, the travelers, and all kinds of different communities. So we wanted to understand, how do we reach out to them, and how can they come to us? And as you know, Sunny mentioned as well, not everybody will come to us. We have to go to them. But how do we create those PPI opportunities for them? Because a lot of the time, researchers would publicize their work on X or other social media platforms, where members of the community, they don't use any of those platforms. So they would be going to their group and talking to people. That would be their first point of call. Or they would have their own WhatsApp groups, which they could have a look and then discuss it there. So we need to talk to them in the way they understand, and provide those opportunities to them in the way they find easier to access as well. So our main aim is to hear from all types of people from diverse range of backgrounds, age, and male, female, and all sorts of different backgrounds. So and we want to also increase our understanding of how we are talking to them. Our communication skills needs to be improved. And it's kind of like both ways. The public understands a lot more how they get involved and what kind of things they can share, and what responsibilities they have, and where they can ask questions. So same with us as well. So we need to, like, working with our researchers, they need to understand how to approach all those community members. And above all, which is quite close to my heart, is giving something back to the community. Very often we go and get them engaged with our work, and then we always make sure that we go back and tell them what's happened, but not all that often we have an opportunity to just give something back to them. So we thought we need to do something about that. Next slide. For all these questions that we had, we knew that we had to engage with the community on a regular basis. So whether we go out to them or create some events and things, so community engagement was the answer for all those questions. Next slide, please. So just thinking about our colleagues in the biomedicals, biostats teams, I thought about an idea where we could use some crafts with numbers, which we could take it to our community members. So we decided to go with iris folding, which is a technique of making cards and other items, which originates from Netherlands. And it looks a little bit complicated when you first look at it, lots of numbers and colors and so on. But we've been taking this sort of craft activity to a lot of groups where we sit with them, we talk about what we do, and then we also show them how it's done. And so they can have a look, follow the the numbers, and when the whole thing is finished, they turn around and the card and they look at it and it looks absolutely wonderful, and they are so proud and they feel the face is glowing that they've actually achieved something so beautiful. So it kind of like gives them that confidence, and while they're doing it, they're enjoying and chatting and talking about other things, which is really good for both sides as well. We kind of get to know about some of their issues as well. Thank you. So far, we've been to 5 different local community groups. One has been a women's group, African Caribbean Center, one at the African Caribbean Community Church as well. And we've been to a cancer support group with South Asian communities and a diabetes support group. But the hardest one has been for deaf and hard of hearing community group. This group doesn't actually have a physical place where they meet. They're only on WhatsApp because of their backgrounds. They come from different countries, so they don't have one language. They don't even have a British Sign Language to communicate with. So we had to find a day which was suitable to bring them all together. And the second challenge was to have an interpreter, because without an interpreter, we couldn't have got very far. So it took us a couple of months at least to find the date, and the interpreter wasn't available locally. So we had to get one from Derby to carry out this session. And they were so surprised, and they said this is the first time any researcher has been to them to talk to them, just to talk to them and hear their views. And they had a little bit more understanding about research, and they were saying they'd love to have more conversations with researchers and understand how it's all done and how they can get involved. So we found that really, really valuable experience working with them, and without an interpreter, that would not have been possible. Next slide, please, Sunny. So these are just a couple of few images where you can see at the bottom people just chatting and just talking about general things, and some cards, and like they're showing their cards, really happy that they've achieved something great. And we've done quick feedback as well of the session straight after the card making session. And there's a lady right at there's a heart right at the top. She's written in 3 languages, nice time. And I think she was 91. So people really have enjoyed their time working together, just, preparing something and talking. When we are having conversations, they'll often talk about their own conditions, and they'll start, because there are times when we have medical doctors as well who would be working on a study, and then they'll start asking about like personal, their conditions and so on. And one question, no matter where we are, it always comes up, is about getting a GP appointment, and we always have to just say, sorry, we can't really help you with that. But these are just like, what their main concerns are in the community. So when you hear something every time, you kind of like make a mental note anyway. But then there are lots of things that people don't say it, but when you're having a conversation, it comes out. And then these things are really valuable for our researchers as well when they are creating they're working on their studies and so on. So they can actually look at something which they hadn't thought about before, but it's another something to think about, and change some of their things that they were looking for in that particular study. Thank you, Sunny. So some of my reflections and challenges are that, which is mentioned before as well, that about time consuming. It takes a long time to coordinate and get everybody together. And sometimes in a community setting, people would arrange a date and everything is all set. And then a couple of days before, they'll say, oh, sorry, we've sort of like, we don't have the room, or we've decided to cancel because there's a festival or something that last minute changes. So we have to really be mindful of that we might need to change some of these things. And also working on social hours as well. I mean, currently I'm working with a group trying to do one of these craft sessions with the Somali community. They used to have a coffee morning on a Friday morning, but they don't meet anymore. So it's on a Friday, 7 till 9. So trying to get people on board is quite difficult, but that's the only way we are going to be able to get to them. So we just have to think about how we try and do that. And there are participants who, some of the elders in the community, need a lot of support, just generally starting conversations and doing the craft activity as well. And it can be quite exhausting when we are sort of like 2-3 hours with lots of people and just talking about things and trying to explain. And when we come back in the office, and you just think, I need a little bit of a break. And translators and interpreters are essential, like, for example, the deaf community. And there are sometimes in our colleagues, with our colleagues as well, we can offer some bilingual skills we have that we are able to support the session, but sometimes it does need to have a professional involved. So we try and work out so that we work and take advantage of any opportunity that is available. Thank you. Thank you.
Thank you so much to the three of you. You'll be pleased to know we've had a lot of questions in the chat already. So do put your questions if you're wondering if you're inspired or you have any questions. We'll try and cover as many of them as we can in this discussion. We'll take away some of the others afterwards, and you can vote for your favourite questions as well. And one of the ones which has been upvoted, which is really interesting, from Hattie at the University of Manchester, is for loving all your tips and guidance. Do you have any advice on making those initial first steps? There are loads of community groups in my local area that I'd love to engage with, but I find it hard to know what that initial reach out should look like. E.g., most connections in research are email or LinkedIn based. Is an email reach out sometimes not appropriate? How much detail should we give about our research in that initial contact? Or am I overthinking it? I don't think you're overthinking it. I think those are all really good questions. Wonder if any of you would like to come in and offer some advice.
Do you want me to answer that one? I'm happy to answer that. So yeah, it's a question that we get a lot of the time. So we deliver an effective community engagement course, and it's a regular question that we get. So I think, is it Hattie, did you say, Matt? I think it was, isn't it? So I think the best thing to do is just actually get out there in the community. And I know it's often a difficult and daunting task, but rather than sending emails to communities or phone calls, I think they want to see your face more than anything else. So it's really important to get out there in the community. Potentially places of worship would be a good start. Again, sometimes daunting for people, but you'd be very surprised how welcoming places of worship could be. So whether it's a mosque, a mandir, a temple, or a synagogue, whatever it might be, just to maybe knock on the door and visit if you can. You often find that community centres in your area will host many groups, for example. So where we are in Leicester, the community centre, there's so many different exercise groups and wellbeing groups during the week. So maybe just to pop in and show your face and maybe have a face-to-face conversation. I think nothing can beat that in terms of engaging with community. And I think, like I said in some of my slides, consistency kind of breeds trust, and so the more often they see you, the more willing they are to engage. I hope that answers it.
Anyone else want to come in on that, or should we move on to the next question? Well, I think the next question is also for you, Sammy, because I think it was in your presentation when this question came up, which is just to clarify sort of what you would mean by normalizing things such as clinical and research. Maybe you can expand a bit more about what normalizing that means.
So it's almost like alien to many people, isn't it? You go to communities and they don't understand even what clinical research might be. So it's just trying to break that down and explain to communities what it might involve and what it actually means. Because, like I said, to many communities, it's not a well-known term, I think, more than anything else, Matt. So it's maybe breaking it all down and speaking to them about that. I don't know if Christian and Gurpreet want to add on to that.
Yeah, can I just pop in? So when we go out to communities, a lot of luckily, a few of us are bilingual, but there is not an Asian word for research. So how do we explain that to, Gujarati speaking people? So we have to normalize it and we have to make it more informal. And I think that comes from the approach that you take, that we all take with communities, and we're seeing so much out in the community before actually we even approach them about a research that we've got in the pipeline. So it is really hard, and it's not a easy process, and it's not a it is a very slow process. I just want to bring that out there. But it is like normalizing the words that you use and the jargon that you use, and not included in anything like that. It is that. Gurpreet, do you want to jump in anything?
Yeah, I'll come in as well. So there are some words, like say for research or even clinical trials and so on in the languages, but they are really difficult for people to understand. Normally you wouldn't use that. So even if I know the language, I'd have to think. But in English, when you hear it again and again, research and clinical trials and so on, you can follow that. But if I said it in Hindi, Punjabi, Urdu, or anything, you would have absolutely no idea because it's so complicated. So by us introducing some of those words, living in this country, which they will be hearing a lot more, makes it easier for them to follow that research or that study which they are going to be taking part in, because we can explain, okay, this is the word and this is what it actually means, and this is what you will do as a participant in this study. So, and obviously we go through all those things that share what you feel comfortable with, and all those sort of things to support them as well. But if you start breaking it down to those languages, it just becomes absolutely unnecessary, and they won't. And even in if we were say, if I was to talk about India, people don't use those words in the languages ordinarily. I mean, only the academics would do that in those languages. Yeah.
Right. And I imagine that the challenge becomes even greater when thinking about data and statistics and artificial intelligence and trusted research environments, etc. Is there anything from your experience working on that statistics project that is helpful for this audience, many of which will be working specifically in data research?
Well, like, I mean, I'll just share one example with working with one of my colleagues. He worked on a study where he was looking at how the condition of, like, Duchenne's condition was changing, and what he could, he was going to work out with his equations and figures and treatment. So when you have a patient, they have a condition, they start deteriorating, they're walking, doing things, and then eventually they're on a bed when they can't move around and do anything. But there is one stage where that patient is able to just stand, even if it's for a few minutes. That stage was never included in his research or anything. So he managed to find that out by talking to people who were diagnosed with Duchenne's early stages and later stage. So then he put it all together. Then he thought, well, that is the missing piece that I need to work on. So then he developed, the work that he was doing. So, I mean, that bit, to me, that's just like in an ordinary way. You think you're here, first you're okay, then that's the bit where you're not okay. But the missing bit is when you are still okay, you're still able to stand, even though you're not mobile, but you can stand and sit on a wheelchair or something. But that bit was missing. So if you kind of like follow that.
Thank you. We've got some really tough questions coming up. I apologize. But the next one I think is a really important one because it's one I've heard, which is about the sort of reality of patient engagement panels having to close or transfer due to funding being cut or reduced, and this becoming more common, and that sort of causing hurt feelings and mistrust. And I suppose the question at the end, how can we manage expectations whilst encouraging people to participate and trying to build those long-term relationships? What can we do in that context?
I think again we speak about the formality and informal approaches to communities, and I think it's just being transparent. To be honest, Matt, with that, I think communities appreciate you being honest. And my colleagues will tell you, we don't always have the answers to everything. So it's putting your hand up and say, look, all you can do is try and build your relationship successfully with communities. And there's often external things that are out of your control, but all you can do is, I think, make every effort to build like an engaging relationships and be as honest and transparent as you can with communities. So that's from a personal perspective. I don't know, Krish, if you want to add to that or.
Yeah, and I think what Sunny means is by managing expectations. So go in and manage that expectation and say to the community, look, we are here to do some research, but we want to build that rapport. And there may be or there may not be further research done in this area. And if there is, we'll come back to you. But just come and speak to us. And I think the most important line here is building rapport. I've been out to communities certainly and done a small project with them. But I've been out again to, on another project, and I've met with that community, and they still remember me a year later or 2 years later. And I think the key is to build the rapport with the community, and then you can almost tell communities anything you like once you've built that rapport. Once they trust you, trust is key. Once they trust you, you can manage those expectations. So don't be afraid of being upfront and just managing those expectations.
I think we all understand there are barriers to engagement, and I guess that's one of the barriers because the communities will often have views and opinions that aren't positive, and I think you just have to accept the fact that that's the case.
But that's why I'm here in the backup. So hello, I'm Anna briefly, and I'm part of PEDRI. So just picking up on that question, in what ways do you facilitate genuine community empowerment and ownership with engaging with migrant communities that may have normalized power dynamics in which leadership and authority are perceived to rest with external figures?
So again, I think it's just more about empowerment and obviously making sure that they realize that their importance and their contribution really does count to what you're trying to do. Whoever we work with, obviously we do a lot of co-creation and co-production, so it's important that they're involved in every stage of community engagement as well. So if we're trying to develop something, we'll go and speak to communities to make sure that they feel empowered enough and they know that the benefit is ultimately for them, and so it's almost like having them on board.
Yeah, can I just add that it means that community's voices are heard, whereas they might not necessarily been have heard before. It means that community's voice is heard, and I think that a lot of communities feel that they're not represented in research. But when you go out, we're in a fortunate position because we do work in the community. We are community engagement officers. Community engagement is our bread and butter. But that's why we're in a fortunate position because we've built that rapport and we can explain to the communities what the researcher wants to, what the research is trying to portray. But again, just building that rapport and making sure that you get on really well with them.
meeting people where they're at, I think, is the common thread through all of this. Thank you very much. I think we've got enough time for one more question. So I'm going to go with the next most upvoted one. So would it be possible to suggest the key aspects for the planning and delivery of a single public panel which seeks to involve a genuine diversity of participants? I imagine liaising with key community gatekeepers would be a fundamental starting point in starting the conversation, but is there anything that could make a panel more attractive to members of different communities? So I think this is a question around the panel format specifically, which I guess there's kind of an interesting potential dynamic there as well.
Oh gosh, do you want to go, Sunny?
I can do. It's just, I think for me, it's having a fair representation of people from various communities. Obviously, if you're trying to, depending upon what the panel is trying to portray, but obviously, if it's going to be more attractive to the wider communities, just to make sure there are enough members of representation from various communities from a personal perspective.
Yeah, can I just jump in?
Yeah.
Community members don't like to be called gatekeepers,
Mm.
so we've learned that the hard way. You know, they're actually called group leaders, or or somebody who represents that community as a whole. So yes, go to somebody that's trusted in that community. Maybe if you're going to a faith organization, go to somebody, the head of that faith organization, and get their buy-in, and ask them who they would suggest as a panel member, because there's no one better placed than a community leader, and they will be happy to suggest people to you or to go on your panel.
And I guess again, it's those that the community can relate to best as well. So the wider, the most diverse as you can get, I guess, would bring more people in. I guess more attractive.
And
Yeah.
I also think, sorry, I also think that it depends on which communities you want to, who your audience is as well. So you need to have, if certain study you're working on looking at one particular community, so you must have good representation from them. And if the panel is going to be repeated or done something else, and then maybe try and involve, like Chris said, ask them who would be the best person from your community to represent if they themselves don't feel right, but also requesting for somebody else next time, because people have different views as individuals as well, whether or not they belong to one community or not.
Yeah, thank you very much. Okay, thank you so much, all. We still have a lot of questions, but we'll make sure that the speakers all have an opportunity to respond to them after this, and we will share that. So I just have a few slides to share to wrap everything up. So just wanted to say, if you have 2 minutes, please scan the QR code to fill in the feedback for this webinar. We really, really appreciate any feedback you have, and it helps us curate this content to be as specific and relevant to the needs of our audiences as possible. So do take a minute or so now to fill that in. It'd be massively appreciated. We'll also send a link in the follow-up email as well. We also have a resources hub on our PEDRI website. So you're not going to be able to access these links, but again, we'll add them to the audience, the email that we send to all of our audiences. But our resources hub has lots of different tools and guidance there to help anyone working with data do good public engagement with their data research, whether you're a public engagement professional, whether you're a researcher, or maybe you're a public member who's involved in a public advisory board or something else. There'll be something there for you to help you work well with data research in the public. So that's all from us today. I just wanted to say another massive thank you to all of our speakers for taking that time, and thank you so much for all of our audiences members for joining today. Hope to see you at the next webinar. Bye, everyone.
Thank you.